Have you ever had your therapist ask if your problems are contagious? Dr. Williams pulled her chair back, actually physically distancing herself from me during our session. Sarah, I need to ask you something unprecedented. Are your issues transmissible? I laughed nervously. Like, emotionally? Trauma can affect others. No, literally contagious. Your specific problems. They're spreading to my other patients. She showed me her appointment book, though patient names were hidden, notes and margins. Now has Sarah's bridge phobia. Developed Sarah's peculiar counting compulsion. Started sleep organizing like Sarah. How is that possible? That's what I'm asking you. 7 patients, no connection to you, have developed your exact neuroses after I've seen you. Same symptoms, same triggers, same specific behaviors. My weird issues were spreading through my therapist like a virus. The bridge phobia I'd had since childhood. The need to organize things by prime numbers when stressed. The compulsion to check if doors were locked in alphabetical order by room name. I've been a therapist for 20 years, Dr. Williams said. I've never seen psychological issues transmit between unconnected patients, but yours are. She'd tested it, scheduled me at different times, different days. The contamination followed my appointment slot. Whoever came after me, within 3 sessions, would develop my specific problems. Mrs. Henderson now has your fear of butterflies. Mr. James acquired your inability to wear blue on Tuesdays. 3 teenagers have your specific anxiety about left turns. I infected them with neuroses. Through me, apparently. I'm the vector, carrying your psychological patterns to others. She'd stopped seeing patients after me, made me her last appointment of the day, but the damage was done. Dozens of people now carried pieces of my mental landscape. We need to study this, she said. You might be patient 0 for something unprecedented. The university's psychology department got involved. They called it psychological transmission syndrome. Somehow my specific neural patterns were replicating through therapeutic contact, not the trauma that caused them, just the symptoms themselves. It's like your brain has made your problems into viruses, the researcher explained. Packaged them for transmission. We've never seen anything like it. They traced it back. Every therapist I'd ever seen had reported similar phenomena. Patients developing my specific issues. I'd been spreading my neuroses for years without knowing it. The bridge phobia alone has infected 40 people across 6 therapists, they calculated. Your prime number organization system? 63 cases. Support groups formed. People who'd caught my problems. They compared symptoms, tried to trace transmission chains. Some were angry, others fascinated, a few grateful, saying my neuroses were more interesting than their original issues. At least Sarah's problems are specific, one person said. My old anxiety was vague. Now I know exactly what I'm afraid of. Bridges, butterflies, and blue on Tuesdays. Dr. Williams developed symptoms too. Despite precautions, she'd caught my sleep organizing compulsion. Would wake up at 3 a.m. to arrange her bookshelf by publication date, then by author's last name, then by spine height. It's actually quite soothing, she admitted. I understand why you do it. The CDC got involved when someone suggested it might be biological, not just psychological. Brain scans showed actual structural changes in infected patients. My neural patterns were somehow templating themselves onto others. You're the typhoid Mary of mental health, one official said, then immediately apologized. They isolated me therapeutically, phone sessions only, with the therapist in a different city. But even that didn't work. The distance delayed transmission but didn't prevent it. My problems traveled through voice, through video, through any therapeutic connection. We could use this, one researcher suggested. If negative patterns can spread, maybe positive ones can too. We could engineer beneficial neuroses. You want to weaponize my anxiety? Therapeutic applications, controlled transmission of helpful compulsions, exercise addiction, healthy eating obsession, compulsive kindness. The ethics board shut it down, but underground, people started seeking infection, wanting my specific problems because they were predictable, manageable, interesting. Better the devil you know, even if it's someone else's devil. I stopped therapy, couldn't risk infecting more people, but the damage was done. My problems were out there, spreading through therapeutic networks, mutating possibly, combining with other people's issues to create new neuroses. Last count, 300 confirmed cases of my psychological patterns. A small epidemic of my specific way of being broken. They formed online communities, compared experiences, tried to trace who infected whom. Have you ever had your therapist ask if your problems are contagious? It's discovering you're not just struggling with your issues but spreading them. That your broken brain is breaking others in exactly the same way. That therapy, meant to contain problems, has become the mechanism for their transmission. Dr. Williams still treats me, despite being infected. We're patient and therapist, but also co-infected carriers of the same transmitted neuroses. She helps me manage problems she now shares. We organize our offices by prime numbers together over video calls. Sometimes, in dark moments, I wonder if everyone will eventually catch my problems. If my specific anxieties will spread until they become humanity's new normal. Until bridges terrify everyone, butterflies cause panic attacks, and the whole world can't wear blue on Tuesdays. But mostly, I just feel guilty and alone. The one person immune to my own contagious neuroses. The source who can't cure what she spreads. The psychological patient 0 who infected hundreds with her specific way of being mentally unwell.